Hi, beautiful people. This is again from Purpose Holistic Wellness. Today's topic is sexually transmitted infection. I'll be talking about the general definition and then most common types of infection, of sexually transmitted infection, the causes, how they are gotten, and then how they are being treated, and what happens if you leave them untreated in the body. Sit tight. So, sexually transmitted infection, like the name says, are infections gotten from sexual intercourse, be it vaginal sex, anal sex, or oral sex. You can get it from any form of this kind of sex. Sexually transmitted infection can be virus, bacteria, or even parasites. So, the first one I would like to talk about is genital herpes. Genital herpes causes genital itching, pain, or sore. Now, it could be given to a baby through labor, by the mother through labor, during pregnancy, or even during nursing, and then it could be gotten by adults through vaginal sex, anal sex, or oral sex. One funny thing about genital herpes is that if not well treated, it can lay dormant in the body for years and then reoccur later. That's one funny thing about it. That's why I always advise that, please, if you know you are sexually active and you know you cannot abstain from sex, because that's the best form of not getting infection. Because sometimes condom can fail, it can tear, it can break, and then you can also get it from oral sex. Do you use condom during oral sex? No. So the best form of, if you know you're not married, the best form is to abstain. If you cannot abstain, now whether married or not married, if you're sexually active, every 3 months, please check yourself out. Do urinalysis or urine MCS. Just check yourself out. If you don't know the test to do, walk into a reputable lab. Tell them you want to check yourself if you have any form of STI. Trust me, they know what to do. Check yourself every 3 months. It's better safe than sorry. Second type of STI I would like to talk about is chlamydia. It's also gotten from unprotected sex, vaginal, oral, and anal. Most of our STIs are gotten from either of that. And then the funny thing is that the mother can give it to the baby during labor, during pregnancy, or when nursing the baby. So that is why we have to be careful. Chlamydia is also very funny. It can lay dormant in the body. It does not show symptoms. It can be in the body destroying the reproductive organs or some organs in the body, and they not even show any symptoms. That's why like I said earlier, that please check yourself out every 3 months. Don't joke with it. If you know you cannot keep body, please check yourself out. It's better safe than sorry. Now, another virus I would like to talk about is human papilloma virus infection, HPV. It causes what in several body parts. It's like the most commonest type of STI, sexually transmitted disease. It's very common. And then one thing is that it's known to cause cervical cancer in women. And funny thing again is that it has vaccine that protects you, at least gives you 80% protection from getting this virus that can lead to cervical cancer. So get vaccinated. Walking into any hospital, reputable hospital, because you can go to a general hospital, tell them you want to get vaccinated. They will put you through. They will guide you on how to go about it. And as a woman too, we should always run some tests. Like once you're sexually active, if you're sexually active, learn to do your pap smear. The test is called pap smear test. You can do it twice in a month, every 6 months, but you can just do it once in a year, just to be, like I always say, it's better safe than sorry. This thing kills. Sometimes there will be no symptoms in the body. You will just feel okay, no itching, no vaginal discharge, no smelly discharge. You're fine. You think you're fine, whereas there's something burning in you, destroying the fallopian tube, rupturing the uterus or something. It's doing something in the body that you might not know. That's why you must always get yourself tested every 3 months. Please, if you cannot abstain, I will keep shouting, saying this over and over again till it sinks. Get yourself tested. You that uncle, you that sister, that you have not gotten yourself tested ever, and that you think you're just enjoying sex, I'm using condom, it's just oral sex, is that you can get sexually transmitted disease from oral sex. Get yourself tested now, today, as in today. Get yourself tested. Don't joke with your health. Now, gonorrhea is another type of sexually transmitted disease. Everybody knows this. It's a bacterial STI that can cause infertility if left untreated, or if it is not well treated. Now, if you know that you have gonorrhea, usually have several symptoms. It causes painful urination, abnormal smelly discharge, lower abdominal pain in females, and testicular pain in men too. It causes testicular pain in men. It affects both male and female, and sometimes it also shows no symptoms. It can cause painful menstruation, urination. It can cause lower abdominal pain in both gender. Gonorrhea sometimes does not show symptoms. Even though it can cause painful urination, smelly vaginal discharge, testicular pain or abdominal pain, lower abdominal pain, sometimes it might not show in the body, like no symptoms. And then if left untreated, like I said earlier, or not treated properly, it can actually cause infertility in both gender. For the man, it can destroy your sperm cells. For the woman, it can destroy your reproductive organs. So getting tested is a very important tool, because if something does not show symptoms in the body and can be destroying some organs in the body, how will you know if you don't get tested? Get tested now. Do not be stubborn. Get tested now. So syphilis is also a bacterial infection, usually spread through sex, vaginal, oral, or anal sex. It causes painless sores. You can see sores in the genital area, but it is painless. You can also see the sores in the rectum, that means the anus, or in the mouth, but those sores are painless, and they are gotten from unprotected vaginal, like I said, vaginal sex, anal sex, or oral sex. It can also be gotten through unscreened blood or untreated needles, unsterilized needles, like all those needles. It can be gotten from unsterilized needles or unscreened blood. Now, it can also be passed from the mother to the baby during labor, breastfeeding, or when nursing, or during pregnancy. Now, there are several stages. The first stage is the painless sore. After the painless sore, then there's this form of rash in the rectum, in the vagina or penis, or in the mouth. And if left untreated, it can damage the brain, the eye, the nerves, and the heart. You see, my dear brothers and sisters, why I am shouting, screaming, repeating myself over and over again that you should get tested. Now, the baba of them all, everything is dangerous. They can actually kill. If not treated properly, they can destroy lives. But this one is very, very serious, because there's no cure for this yet. HIV/AIDS. HIV is known as human immunodeficiency virus. AIDS is acquired immunodeficiency syndrome. Now, HIV has several vaccines, several drugs that can bring them down. That, in fact, if you have HIV, you can live as long as you want, in as much as you're on your drugs. If you're using your drugs, or you have the vaccine. In fact, someone with HIV can get married and also infect the partner. There's so many research. Even if there's no permanent cure for it, but you can live with it and live an healthy life with it. But AIDS has no cure. And AIDS is gotten when HIV is left untreated. Then it abbreviates, it becomes AIDS. Now, basically, it destroys the immune system. It makes the body weak. It does not, naturally we have agents in the body that can fight. They fight off our white blood cells. It helps fight off diseases without using anything. God has created it that way. Now, when you have HIV, it destroys it, making the body vulnerable to all kinds of infection and diseases, hence leading to death. Now, like I said earlier, all kinds of infections are gotten through almost the same method, through sex, unprotected sex. And sometimes you might think you're using condom and it will burst. See, let us just round this up. Don't let me keep going on and on, because it's like I'm repeating myself over and over again. And the major reason why I'm repeating myself over and over again is because these things kill. If you leave them untreated, they destroy lives. Imagine you not knowing you have gonorrhea because you had sex probably just once. Imagine you just having gonorrhea. You didn't know. It did not give you any symptoms. You're ready to get married or settle down. You can't give birth. It destroys life. It destroys your charisma. It destroys lives. It kills. That's another funny thing. It kills. AIDS kills. Gonorrhea kills. If they kill, they destroy lives. That's why it's like I'm repeating myself over and over again that get yourself tested every 3 months. Every 3 months. We have 12 months in a year. That means get yourself 4 times in a year. Or better still, abstain totally. There's nothing like I trust my husband, I trust my wife here. Okay, it's better sit down. Sorry, if you really love your partner, you and your partner can go in together and get yourself both tested. The reason, another thing is, look at genital herpes now that can lay dormant in the body and now reoccur years later. Imagine, they might not be cheating, fine, but what if they've had it before and they didn't treat it completely? It went and then laid dormant in the body, then it's coming back again. They will give it to you. They have it in the body. They didn't know. You can. Another good thing is that when getting married, getting all these tests done are very important. In case they've been laying dormant in the body, you can treat yourselves without and get knowledge. Don't just say, she has infection. Some of these infections can actually lay dormant in the body and you will not know. So, but getting tested, there's no how it is in the body and you get tested and you will not know. Like I always say, better safe than sorry. Now, at Fefis Holistic Wellness, we have infection flusher. We call it Fefis flusher that helps flush infection out from the system. Depending on how high that infection is, that's how your dosage will be. For some people, it's just 2 capsules daily. Some two capsules twice daily. Some 2 capsules 3 times daily. Depending on how intense the infection is, we use Fefis Flusher, Fefis Cleanser, and our Fefis Booster to treat infection. And we treat it for 8 good weeks. 8 weeks. That's 2 months straight, non-stop. It does not destroy the liver or destroy the kidney. It is well formulated to help all kinds of infection, but you must get prescription so you can use it the right way. You cannot just buy and say, I just want to buy this. You must get prescription to treat it the right way. Now, finally, there are also some fruits, veggies, and some things you add to your diet that will help this infection, that we are going to tell you why you're using these drugs. There are some things you have to abstain from, like alcohol, that can limit the effect of the drug or the things that are using to treat yourself. There are so many things that can limit it, but we are going to explain to you properly when you're ready to. So please listen to this very well and let it sink. And like I said earlier, if you've not gotten tested before, or it's been a while since you got yourself tested, please go and check yourself out. You might have an infection in the body that is laying dormant and is destroying your cells. Please, 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 and please. Thank you very much for listening. Till next time. Ciao, ciao.